Today's webinar is being recorded. Everybody will get a copy of the recording at the end of the day today. Also, for questions, we will be answering questions at the end of the webinar. If you have any questions, please enter them in the chat box below, and then we will get to them at the end of the webinar. So without further ado, I'm going to go ahead and introduce Scott. Scott has more than 30 years of clinical nursing and management experience that has been used to position hospitals and nursing homes to sustain financial viability and secure their futures with a focus on governance, strategic positioning, operational, and financial improvement. He has successfully managed the financial turnaround of multiple skilled nursing facilities and has also served as project manager on multi-million-dollar SNF replacement projects. Scott has also leveraged his healthcare operational experience to design, develop, and implement healthcare compliance and HIPAA programs. Thank you so much, Scott, for giving the presentation for us today. I'm going to hand it over to you now.
Well, thank you, Sarah, very much. And welcome, everyone. Good morning, good afternoon to everyone from West Coast to East Coast, wherever you are. And I'm very happy to be here to give this talk on board and governance responsibility. And obviously, my background, you can see that I always say in my prior life, I used to be a registered nurse on the acute care side. But I've been doing management work for, again, over 30 years now, which basically means that I got more gray hairs every day. But from that management experience, as we started doing at our company compliance and HIPAA consulting work, we used and leveraged that management experience to help our clients put together effective compliance and HIPAA programs within their organizations. And we do a lot of work with various healthcare providers, but mainly, the standalone providers like hospitals and critical access hospitals and nursing homes that don't have that huge corporate structure to be able to support such programs. And those are the providers that are always struggling to put into place effective compliance programs. And so hopefully what you'll learn today will provide you some valuable oversight and tips on how to better engage your board so that they can help support your compliance efforts within your organizations. So I've got 30 plus slides to go over, and I want to make sure I leave time for questions at the end. So let's get started. So, I think the biggest problem or conundrum that any CEO, administrator, compliance officer, security officer, or privacy officer has is in regards to getting the board involved is there's really a big lack of guidance. And so, with the OCR, if you take a look on the right side of the slide, you've got the privacy, security, and breach notification rules. But when you look through those rules, there's absolutely no guidance or guidelines for how to work with your boards with those three functions. Now, on the overall healthcare compliance side, you've got the Office of Inspector General, and they had put out guidelines for provider compliance programs starting off in, was it 1998 or 1999 with hospitals. And in the compliance guidance, they recommend that boards be involved, but again, they don't provide a lot of detail on how that should occur. And I also add here that, HIPAA privacy and security is a specific risk area that was identified by the OIG that compliance programs should cover. And so I put that in the slide just as a reminder to everyone that, you can easily look at HIPAA separately from a compliance program, but in many cases, and I think at least with the providers that we work with, the HIPAA privacy and security programs are a key component of the overall compliance program. And so what does that mean from a practical standpoint? It means that your compliance officer is working hand in hand with your security and your privacy officer in developing and identifying those risk areas and addressing those risk areas on both the compliance and on the HIPAA side. So in terms of board responsibility engagement, why? Why is this an issue? Why should you be doing it? And at the bottom of the slide, so I'm going a little bit from bottom to top here, the OIG does have, since they put out the guidelines over the last number of years, they have identified that providers do need some help and guidance on the governance side. And so they actually do have resource materials. And I put the link there. And again, what they have is, some a number of documents to help with what do you do with your governing boards, toolkit, practical guidance, and the healthcare director's compliance duties. So those are very useful resources, and I actually reference one of those in future slides in this presentation. But the two main elements about why that the board needs to be involved, you have this phrase or issue called duty of care. It comes from a legal case that we'll talk about shortly. But also, because of that, there's also personal liability that directors have for non-compliant activities that occur within the organization. And so, I'm sure all of you probably have had, directors ask, am I personally liable or responsible for what's going on in the organization? And the quick answer is yes. So one of the first guidelines that have been out there are the federal sentencing guidelines. And these are policies for sentencing individuals and organizations that have been convicted of felonies at the federal court system level. So this is not at the state level, but at the federal court level. And when these guidelines first came out, I believe they were mandatory, but since then, it's been pulled back where the guidelines are considered advisory only for where federal judges, basically must consider them when determining a sentence, but they are not required to issue sentences specifically based on the guidelines. And within the federal sentencing guidelines, they do mention an organization's governing authority. So again, this is not specific to healthcare organizations. This is for any organization or business that gets in trouble with the federal government. And so in the sentencing guidelines, it says that the governing authority shall be knowledgeable about the content and operation of their compliance and ethics program, and they shall exercise reasonable oversight with respect to the implementation and effectiveness of their program. So clearly it's a significant issue because it's included in the sentencing guidelines, but the problem here is that the guidelines is not a great resource because there's no details or guidance on how you meet those expectations. So probably one of the most famous or most referenced legal case is the Kmart false claims case that was settled with the OIG back in 2002. And so Kmart is a pharmacy benefit manager. And one of their subsidiary units called Advanced PCS, they ended up settling for the allegation of knowingly soliciting and receiving. So they gave out and they also accepted kickbacks from pharmaceutical companies in exchange for favorable treatment of the medications that were provided by that manufacturer. So basically, and the way I always paraphrase it is that, those drugs, because of the kickbacks, were higher up on the list of recommended medications. So in 2002, Kmart settled with the federal government and agreed to pay a $137.5 million fine, or civil monetary penalty to settle the lawsuit. And it was a whistleblower lawsuit that was brought forth by 3 former company executives of Advanced PCS. And so the actual false claims case is not germane to what we're talking about with board involvement. But what happened almost immediately after Kmart settled this false claims allegation, the shareholders of Kmart filed suit against the board where they alleged that the board of directors breached their duty of care by failing to put in place adequate internal control systems which allowed the company's employees to commit the false claims offenses that were settled a few months earlier. So again, I'm not a legal person. I'm a registered nurse by background. So, this slide is always there to remind me about what exactly is duty of care. And so the duty of care refers to the obligation that the directors have to exercise the proper amount of care in their ability to make decisions on behalf of the organization and to have adequate oversight over the organization. So again, it's, a board is responsible in general for governance and strategy. And so in this case, that's what we're talking about here. And in this court case, it raised the question regarding compliance of what is the board's responsibility with respect to the organization and its ability to monitor what's going on with the corporate functions within the law to achieve its purpose. So what does that mean? Again, good oversight. So the duty of care is also, and this was in the court case summary judgment, a duty to attempt in good faith to assure that a corporate information and reporting system in which the board concludes that that reporting system is adequate and exists, and that the failure to have that information and reporting system under some circumstances may render a board member or director liable for losses caused by the non-compliance of not having that information and reporting system. So again, the key phrases here is a duty to attempt in good faith. So I probably should have bolded and underlined attempt. So it doesn't mean that it has to be a working system, but there has to be an attempt to have a good reporting system in place. And so in the case of Kmart, the argument was that there was not, or an absence of a corporate information and reporting system. And again, the judgment also, or the court also went on further to say that only a sustained or systematic failure of the board in its ability to exercise oversight, and they called that an utter failure to attempt to assure that that information and reporting system exists, will establish the lack of good faith. So again, I put as a summary, utter failure equals bad faith, but the court also said that that bad faith equates to intentional wrongdoing. And that is significant. I mean, that is basically saying that an absence of something, in this case, a lack of a reporting mechanism, is equating to intentional or active wrongdoing by the board. So, I mean, that is a significant segue, if you will, about having a lack of something with the board. So that Kmart case is a big reason. A duty of care has always been the, if you want to call it, the mechanism or the reason why you need to have board involvement. But again, it still doesn't answer, okay, so how do you do that? There was a recent case that reached the Delaware Supreme Court. So the Kmart case, I forgot to mention, was a court case that occurred in the state of Delaware. And so more recently, there was a Supreme Court decision in the state of Delaware, and it was an argument that was made where they cited what is called now a Kmart claim, which is referencing the Kmart case. And this is not a healthcare related lawsuit, but it was a lawsuit against the board of Bluebell Creameries. So Bluebell makes ice cream. They have 3 plants, at least at the time. I don't know if they still do, but I believe there's 2 plants in Alabama, and the third, is it in Louisiana? I may be wrong on that third, but they have 3 plants in the South. So in June of 2019, the Delaware Supreme Court case ruled on this case. And it was, again, a stockholder lawsuit that alleged that the board of Bluebell Creameries breached their fiduciary duty under the Kmart claim by having failed to oversee and monitor food safety operations. So at the lower court level, the case was dismissed on the basis that Bluebell's food safety operations were subject to a reasonable system of oversight by the federal and state regulators. But this case went to the Delaware Supreme Court, and that body overturned the dismissal, and they found that the board itself had not taken action to assure a system for board oversight of the food safety. So again, the argument was a Kmart claim, and they basically agreed that Bluebell's board did not meet the standards that were set by the Kmart case. So a little bit of background about the Bluebell food safety issue. So between 2009 and 2013, the FDA and state regulators had identified a number of sanitation problems and failures. And then between 2013 and 14, there were actually some lab swabs that identified listeria and other contaminants in their plants. And so, long story short, what happened is that listeria eventually got into the ice cream. And in early 2015, there were 8 people that got sick by the listeria in the ice cream. And 3 of those 8 consumers ended up passing away. And the CDC investigated, and they found that the listeria infections were linked to 2 of the company's plants. And so just earlier this year, in May of 2020, the case was finally settled, where Bluebell pled guilty to 2 misdemeanor counts of distributing contaminated ice cream products, and they ended up paying a total of about $19.35 million to settle the criminal fines, but also a Civil False Claims Act allegation as well, to the tune of about $2.1 million. And so there are some key findings in the Supreme Court decision to overturn the lower court's dismissal. And what they found was that there was no board level oversight over food safety. There was no regular processes or protocols where management was keeping the board informed of any food safety compliance practices, risks, or any reports. There were no regular schedules for the board to review anything related to food safety, despite the fact that the managers of Bluebell had received reports, and according to the Supreme Court, they could have been considered at a red level or at least a yellow flag, and that the board minutes of the relevant period that was looked at showed no evidence that there were any discussions with the board of any of these negative reports about or issues with the food safety at the plants. And again, despite the fact that, or ironically, that what was reported to the board was a favorable food safety inspection report. So They provided information to the board about the good things that were happening at the plants, but there was basically no reports to the board of any food risks or any issues that were going on at the plants. And again, absolutely no evidence of any discussion of food safety at the board level. And so, and those were the reasons why the Delaware Supreme Court overturned the lower court's dismissal of the lawsuit. So some of the findings or lessons that you can take away from this Blue Bell case is that the Supreme Court stated very specifically that the Kmart claim does have a high standard to meet. But in the case of the Blue Bell board, they utterly failed to put into place any type of monitoring system regarding food safety. And the court also specifically acknowledged that a Kmart claim does not depend on whether the board's oversight actually works, but that only a reasonable system exists and was monitored by the board. So again, the key thing here is that you have to have a system in place. It doesn't mean that that system has to be perfect in identifying and fixing everything or reporting to the board. So again, there's got to be a reporting mechanism that the board is hearing, seeing, and is hearing about good and bad things that are going on within the organization. In the next two slides, I just wanted to provide an example. So it's of where at the federal level, whether it's an assistant U.S. attorney or attorney with the Department of Justice, this example is where the OIG is going in, or Department of Justice is investigating a healthcare entity for potential false claims. And the moral to the story here is that when investigating a healthcare organization, they will actively look at the communications that are going on between management and the board. So in this particular case, it's Life Care Centers of America, which is one of the largest national nursing home chains. And it was a $145 million false claim settlement where Life Care Centers were alleged to try to maximize their Medicare reimbursement levels for physical therapy or therapy services provided in a skilled nursing facility. So high levels of reimbursement, maximizing length of stay, and also the allegations were that they falsified the documentation to support the claims that were submitted to Medicare and to TRICARE. So some of the things that were cited in the investigation is that they looked at and saw that at divisional and regional meetings that the maximization of revenue was reinforced at both divisional and regional meetings. There was actually a corporate committee called the Rehab Opportunity Committee that functioned to identify specific facilities within the organization that failed to meet the financial targets. And there were specific examples where corporate executives would actually call a facility's rehab manager and ask about specific cases and why those cases were not being recorded at a higher reimbursement level. And the membership on that Rehab Opportunity Committee included the chairman of the board, the former COO of the organization, and the executive or the corporate vice president of rehab services. And so again, these were points that were cited in the investigation. And again, I provided to you to show that in the course of an investigation by the feds, they are looking at the communication that's going on within our organization and its board. So when you put this all together, it says you've got to have your board involved in what's going on with the organization. So let's segue and start talking about, okay, so how do you get the board involved? And so, again, this is based on our management experience. And so to a certain extent, I'm talking about what we're doing with our clients. And so, and I say that because involving a board is more of an art than a science. And hopefully, as I talk through the next slides, you'll get an idea of where I'm going with this. But the focus in my dealings with the board is specifically on the core business of your organization. And for healthcare providers, that focuses on providing excellent patient care and quality of healthcare services to those patients. And in this slide, I'm citing the healthcare director's compliance duties. And in that reference, it says, to realize its full potential, the board needs to develop an understanding of the relevant quality and patient safety issues, and then focus on performance goals that drive the organization to provide the best quality and most efficient care. So what that means when I talk with my boards is that it says that if we focus on providing the best care possible, everything else, the performance goals, financial goals, whatever they are, will fall into place if we're meeting the goals of our core business. The board should also focus on the risks. So the board should be receiving compliance and risk-related information in a format sufficient to satisfy the interests of those members. So what that means is, it has to fit their capacity to review that information. So that first bullet, what it means to me is you have to cater your communication to your board based on the experience, the background, and the personalities of your board. And as your board changes in membership over the years, you're going to have to adjust to those differing backgrounds and personalities and how you're going to communicate to those board members. Some boards in the second bullet, like to see dashboards, but someone may want to see reports. They may want to have more verbal communication. But at the end of the day, what management is providing to the board is always a balance between providing the right amount of information, because providing a lot of information doesn't mean it's good. And again, obviously, providing too little information is going to be inadequate. So there's got to be that balance in providing the right amount of information. You also need to focus on risk mitigation. So you're telling the board about risks that you have operationally, but you also have to talk about how you're going to address those risks to minimize or eliminate those risks. So, you identify the compliance risks, you investigate from a management or operational standpoint those risks where you're avoiding duplication of efforts and implementing appropriate corrective actions and making sure that there's clear communication of those corrective actions within the organization and up to the board. And so again, you make a decision, you identify a problem, and you implement it, and you also need to make sure that it actually works. Because there are many cases you put in a corrective measure and it fails. And so you have to identify that and then segue and come up with another solution to the problem. So where do you find these risk areas where you're going to communicate to your board? And so, in general, you've got external and internal sources of information that you can use to identify risk areas. And so again, in one of the OIG documents, the Guidance for Healthcare Boards on Compliance Oversight, they specifically mention that you should look at external sources, and those are lessons learned from other providers that have stubbed their toe. So when there are failures or problems in those organizations and you read them in the news, or if they are in OCR press releases or with the OIG, the board should be asking those members, the board members should be asking management, or more importantly, I think, the management team, compliance officer, CEO, administrator should be reviewing those failures and saying, is this something that could actually happen within our organization? Is it a risk area that we should look at? And if so, then do we need to identify where that could happen with an organization and put in corrective measures before it actually becomes an issue? So again, lessons learned from other organizations, and being proactive and implementing corrective actions before it actually becomes a problem within your organization. So again, where do you get those? From the HIPAA side, on privacy and security, the go-to source is the OCR news releases and bulletins, and I've got the web page for that. And you can also sign up to have those sent to your inbox on a regular basis. The other thing that we do is that we basically look for news articles. And one of the easiest ways to do that is you can set up at Google, you can do news alerts, where literally you type in a word or a phrase, whether you can type in HIPAA, HIPAA security, you can type in HIPAA breaches, and you can get references to news stories across the globe, across the country, with those tags. And you can set it up where you can get them on an ongoing basis, once a day, whatever you prefer. But I can warn you that if you have a very general tag, you can get hundreds of emails on a daily basis. So you have to kind of be hit and miss, or take your time to figure out exactly what type of news that you want to see. But we literally use those news stories to augment whatever gets publicized by the OCR, and use that as education and training material, not only for the board, but everything I'm citing here can also be used for employee and manager training within your organization. But I want to talk about what I consider the go-to source, which is the OCR news releases. And I provide this table. This is statistics from the OCR on calendar year cases in actual settlements, or CMPs, which stands for civil monetary penalties. And so the news releases that the OCR puts out are those settlements or CMPs. And you can see that based on the total number of cases that occur on an annual basis, there is less than 1%, significantly less than 1% of the cases ever end up as a settlement or a CMP. So what that means, the takeaway that you should have, is that when the OCR publicizes a settlement, they are sending a specific message. There is a method to the madness of why they have settled that specific case, because they believe it's a key risk area. It's a strong message that they're saying to other providers that be aware of this risk, and you should make sure that it doesn't happen within your organization. So I'll give you one example of a case, and it is careless handling of a patient's HIV information. And so this was a case that was sent to the OCR back in September 2014. And what happened is that a patient had asked the healthcare institution to mail his medical records to his personal PO box. And what that hospital did was accidentally faxed information to that patient's employer. And unfortunately, that information included HIV-related information, including the status, medical care, history of sexually transmitted diseases, medication, sexual orientation, and also some mental health diagnosis and history of physical abuse. And so the OCR also found in the course of this investigation that a similar type of breach had occurred 9 months previously, and that there was no corrective action that was taken to prevent a reoccurrence. So basically what happened here had happened before, but the organization didn't do anything the first time around. And so remember, it's a breach of one record, and organizations settled for $387,000. And so here's where I'm giving you a little bit of tips of what I do when I read these OCR press releases. And the first thing I always do is read the quotes in the press release that comes from the director of the OCR, who is Roger Severino. And in this particular case, there are 3 quotes. And these are the messages that Mr. Severino, the OCR, is communicating to the providers. First, individuals cannot trust in a healthcare system that does not appropriately safeguard their most sensitive PHI. So again, the message here is there's certain types of medical information that are considered much more sensitive, and that's psychiatric medical records and any other medical records that could be considered, if they're disclosed, could result in discrimination against that individual. And again, HIV is in that category. So it is a much more sensitive PHI breach. In the second quote, covered entities and business associates had the responsibility under HIPAA to both identify and actually implement these safeguards. So again, there was a prior incident 9 months before that went uncorrected. And then the last quote that Mr. Severino had, in exercising its enforcement authority, the OCR would take into consideration aggregating factors such as the nature and extent of the harm. And so what he's talking about here, and it just so happens that I watched a speech by Mr. Severino, what he was specifically talking about in this case is that put yourself in the shoes of this patient. So he's working at a place of business, and in all probability, none of his coworkers know about his medical condition. And now probably the whole organization now knows what's going on from a medical standpoint. Do you think that that person is going to feel comfortable working within that organization from that point on? And that was the point that Mr. Severino was stating with this third quote. So those are the aggravating factors, that you had very sensitive PHI that got disclosed to his place of business that probably made things at the very least uncomfortable, if not made it impossible for him to continue to be employed with that organization. So again, when you read these cases that are settled with the OCR, take a look at it and ask yourself, what are the key lessons to be learned from these breaches? And then you turn around and say, okay, can this stuff happen within my organization? You know, could we have someone who accidentally sends a fax to the wrong person or wrong location? And I think we can all say, yes, that can easily happen. So how do you correct that? Then you have to figure out within your organization what's the best way to do that. You know, is it as simple as reminding everyone when you're sending a fax that you have to double check that you're sending it to the right fax number? Whatever the case, you're looking within your organization to see what procedures that may be missing that you need to put in place to try to minimize, if not eliminate, this potential breach from happening within your organization. Internal sources on topics to educate your board. Your security risk assessment and management plan, that should be your go-to document, because you're specifically identifying any security, HIPAA security risks within your organization, and the management plan should be what strategies that you're implementing to reduce those risks. You probably have internal audits, such as, you know, I think almost every organization will have a HIPAA walkthrough that security or privacy officer will do, just walking around to see if there's any, you know, potential PHI breaches, you know, PHI found in the trash cans, you know, computer screens that are left unattended that are still open, et cetera, et cetera. Your compliance hotline complaints. Any questions, in addition to complaints from the compliance hotline that are related towards HIPAA. With a lot of our nursing home clients, probably the #1 issue that we've had is actually social media breaches or potential breaches where you have staff taking pictures or texting about work-related activities. I mean, those are all potential breaches that we investigate. Any questions that are posed to your management staff or supervisors, you know, that could be related potentially to any risk areas, or are there any patterns of consistent questions that are being asked, could be areas of potential risk. We've also found that exit interviews, when you can do them with your employees that are separating, you may find that they may mention, oh yeah, you know, I saw a HIPAA breach, or, you know, I saw this potential compliance issue, but I never reported it. And lastly, and I think very importantly, it is, I think, a very effective tool to do employee surveys, where you also include compliance and HIPAA-related questions. And so, again, you know, it could be very basic questions. You know, do you know who your compliance officer is? Do you know who your privacy officer is? Do you feel comfortable in reporting a possible compliance-related or HIPAA issue to your supervisor? Have you ever witnessed potential non-compliance within your organization? Did you report it? And if you had reported, or did you know someone who reported it? Did you witness, or had you been subject to any retaliation? And I can tell you from our clients who have done these surveys, you'll be surprised, whether it's pleasantly or taken aback by the answers. They can be very, very informative in terms of your compliance culture within your organization, and how comfortable and how much your employees have internalized your compliance and HIPAA programs within your organization. Okay, so the next few slides are talking about how to actively engage your board with your compliance and HIPAA program. And so you have foundation documents, which are your compliance program policy and code of conduct. And your compliance program policy is basically telling you what is your compliance program. The code of conduct, it says this is how we expect our employees, supervisors, and board to act in regards to supporting a compliance program. We developed a compliance program resolution. So we said, okay, so when you first put together your compliance program, have your board formally approve a resolution that includes, we're going to implement a compliance program, but we're also we reviewed and accepted the compliance program policy and the code of conduct. And we take a step further and say that that compliance program resolution will be reattested on an annual basis. So if you put together your compliance program 20 years ago and you had a resolution, let's say you didn't have a reattestation. So how do you prove that your board today is still supportive of your compliance program? That's the reason why we implemented a reattestation on an annual basis. Then there's absolutely no ambiguity that your board continues to support the compliance program, because you can show anyone that's investigating your compliance program, well, here, I've got annual reattestations for the last 20 years. Have your board review and approve the job description for the security officer and privacy officer, as well as your compliance officer. Security officer and privacy officer can, again, be, their hiring can be approved, or at least you can show that you presented to the board that this is the security officer and privacy officer and your compliance officer that you hired within your organization. And so it reflects in the minutes that that information was provided to the board. And lastly on this slide is that you can show in your minutes that your compliance program and where your technology budget was formally adopted by the board. So what does that mean? It doesn't mean that when you're going to the board for your annual budget approval, that you have another 10, 15, 20 page document that details your compliance technology budget, but you can bring up in the presentation to the board, specifically, here's the compliance budget, here's my technology budget, and here are the things that we're going to be addressing for the next fiscal year within that budget. And I think the other key thing that you should also communicate to your board, especially for the smaller organizations, you probably have a significant checklist of compliance-related tasks that need to be taken care of that you cannot accomplish within the 12-month period. But in your board communication, you're saying, here are the priority items that we're going to tackle this year, and here's what we're going to tackle maybe in the following years, year 2, 3, 4, whatever the case may be. But the board understands what you're addressing now and what you're addressing later, based on the available resources that you have in place. So the compliance program resolution. So again, it clearly states in writing the board's commitment to compliance, that they're adopting the compliance program policy and code of conduct. It is establishing the compliance officer, security officer, and privacy officer positions, and establishes the organization's compliance committee. Now, for larger organizations, it would also establish the board level compliance committee and or a technology committee that may need to be in place for those larger organizations. And again, you want to have that paper trail, which is typically going to be your board minutes, where you can specifically show that the board is receiving regular reports on your compliance program activities, that there is discussion about those compliance related matters. So literally meaning in the minutes that you could say, at this quarterly meeting, we've talked about A, B, C, and D, and that there were questions generated by the board, and provide specific examples of questions that were asked or discussed, so that there's just a little bit more detail in the minutes in regards to compliance related matters. And again, another tip for board engagement is that, typically most boards, the board report is being given by the administrator or the CEO. But what we like to do is actually have some of the managers provide an update to the board. And so in the case of compliance, you could have a rotating schedule of having a brief report from the compliance officer, privacy officer, and security officer, in addition to the administrator. So it also, again, it provides the ability for the board to actually hear and see and hear from other individuals in the organization besides the administrator. And again, the board should be reviewing the effectiveness of your compliance program. And so your annual report, and so that should include your security risk assessment and management plan, which should be reviewed at least on an annual basis. And that reporting should also cover what is being done to prevent, detect, and resolve issues. And as I mentioned just a minute ago, are there any resources or budget limitations that are in place? And again, I think every organization does, but communicate that to the board, because again, the message has to be consistent that you're providing both good and bad information to the board, but it gives them a clear understanding of what is expected over the next 12 months and what are the limitations to expect over the next few months. On the flip side, again, you have to have engagement with the board by your compliance officer, privacy officer, and security officer. So again, if you have monthly meetings with your board or quarterly meetings, whatever the frequency, again, have that rotating schedule where at least, I think at least on an annual basis, your privacy officer and security officer are making a report to the board. But in addition to that, you've got to have procedures in place for those direct reports. And one of the things that we have, and this is specifically for a compliance officer, do you need to have standing approval where your compliance officer or your compliance team can actually contact legal counsel So if they identify a risk area, or they do an audit and they find that there's a, so example, you have a potential HIPAA breach, it would be good for the compliance officer to be able to reach out and make a call to legal counsel and say, here are the issues that I have that we discovered under audit or under a complaint through the hotline, and here's our initial findings. Is this an issue that we need to investigate further? And if so, legal counsel could say, yes, we need to investigate further, and we can do it under attorney-client privilege. Then you can go to your board and say, here's what's up. We've got this issue that we're starting to investigate, as opposed to having to go to the board to get approval to seek legal counsel. Because again, when you have a potential HIPAA breach, you're on the clock for notification to affected individuals. So you don't have a lot of time to waste. And so by having a standing board approval for your compliance team to seek legal counsel, that saves a big step of having to get approval from your board and or from your CEO. And again, that's a style issue that has to be discussed with your board, with your CEO, in putting that into place. But it's something that should be discussed before something happens. The compliance officer should provide an oral report to the board at least quarterly. But what we also do is that we provide a monthly written report to our board on all compliance activities that are going on within the organization. And that document also includes industry news about what's going on with compliance and HIPAA related matters. And by providing that monthly written report, it reduces the amount of time needed to present in front of the board. So literally, a compliance report to the board can be limited effectively to no more than 15 minutes. But that live presentation has to be augmented or supported with regular reports to the board. So again, whether it's monthly or every other month, some systematic process of providing written reports to the board on a regular basis can go a long way to making sure that your board is engaged in understanding of what is going on within your organization and also within the industry. So what does your management team need to be reporting? Basically everything I just covered, you just flip it around. So internal activities or sources of information, key risk areas, what's being done to eliminate or reduce those risks, the annual review. Those are the resources that you look at to come up with information that you're going to report to the board. External, those industry trends, enforcement updates, and those Google News alerts. Going through those and saying, okay, which of these are relevant to my organization? And then you summarize them within a paragraph or two. So again, that monthly report, we use all of these resources to put together that monthly report to the board. That report is not going to be 20 pages long. I mean, if you keep it down to less than a handful of pages, that's great. But it is sometimes very difficult to do with everything that's going on in the industry. But you want to provide your board with a concise and hopefully short written report on a regular basis of compliance activities. And that report is augmented by periodic live in-person reports to the board. So again, what are your current HIPAA risk areas and the mitigation strategies that you have in place? You want to talk about potential breach investigations that are ongoing. What was the resolution to those? Did you need to report those to the OCR? You summarize your hotline complaints. Are there any trends, positive or negative? And what was uncovered when investigating those complaints? Give findings or a summary of your employee survey related to compliance and HIPAA. And again, talked about before, trends and industry news or examples that would be good for the board to hear about. All of these things, again, are perfect items to report to your board. The key thing to think about as a manager, you don't want your board to be surprised. So you have to provide good information with the bad information. Again, monthly compliance and HIPAA report, live quarterly reports to the board, rotate reports by your compliance officer, privacy officer, security officer. You know, I talked about in one of the slides that you want to talk about patient care related issues. So you may want to have your director of nursing and other senior managers in your organization to periodically provide reports to the board across the board. And in the next two slides, I'm just providing a couple of easy examples, and again, or tools that you could use to try to consolidate and summarize all of the compliance-related information that's out there that you're trying to report to your board. And so this is just an easy summary of all your compliance-related risk areas. And this is pertains to what we do for our nursing homes. And so you can see in the third row at the bottom that HIPAA is in there. And so for each of the risk areas, you're assigning a risk level. If you're doing audits, how often you're doing audits. So if it's a higher risk area, you're doing more frequent audits. What was the date of the last audits? Sample size, were there any issues found, and what are you being what's being done to correct any issues that came up. And again, within HIPAA, you may have a separate report that lists specific risk areas within HIPAA. And again, you basically just change the headings from quality of care to phishing emails or to ransomware, whatever the case may be, and assign risk levels to each of those specific HIPAA issues. And then an example of what is the strategies that we are implementing over the next 12 months. I have an example here of a specific compliance issue, which is complaints in line of communications and some of the findings or areas that we are addressing. And so specifically, you take a look at the second row where it says staff frequently asks compliance officer about HIPAA. And in this particular case with the nursing home, it was about social media, that the action plans that we're addressing these topics in the compliance training plan. And so meaning that we are doing an active training of the employees on social media risks. And the completion goal means throughout 2020, we are going to have multiple opportunities of training and education and reminders to the staff and who's responsible for implementing that action plan. In this particular case, it's the compliance officer and the security officer. So again, this can provide a very succinct summary to the board of the activities that are going on within the organization. And again, this is easily part of your annual plan. And so it could be multiple pages, obviously, but then you have the summary saying, here's all the things that we're doing. And this provides a backup document of what, or more details, if the board wants to take a look at it in terms of what we're actually doing. But hopefully this way, it provides a way that you can provide clear and succinct information to your board. So again, my final thoughts. Board involvement within your organization cannot be overemphasized because your compliance efforts requires a full commitment of everyone within your organization. That means from your line staff that are at the bedside to your board and everyone in between. It's your senior managers, your department managers, all of them have to be on board because it's so easy for anyone at any level to undermine your compliance efforts. Know and understand your board members' backgrounds. You know, if they have absolutely no HIPAA experience or technology experience, that is going to frame the way you're going to communicate to them that you're going to need to provide probably more training on HIPAA security issues. What are their personalities? I mean, literally, are they quiet? Do they ask a lot of questions? Because someone who doesn't ask a lot of questions doesn't mean that they understand everything. But so you have to understand those nuances of the personalities of your board members. And the only way you can get a good understanding is by communicating with them as often as possible, engaging with them. And that way you get a better understanding of their level of expectation and what they want to hear and see from you. So again, a little sweat equity will pay dividends. And that means, doing that monthly report to the board, making an extra phone call if necessary, if it's a sensitive issue, to talk to a board member. Any opportunity that you have to reach out and engage a board member will pay dividends in the long run. Because again, you don't have a lot of time at a board meeting to talk about compliance related matters, because you have all the other issues that are being discussed at the board level. You don't want to have a board meeting that goes for 2 or 3 hours. The length of a board meeting, without question, does not equate to the effectiveness of the board meeting. I try to keep my board meetings to an hour, and sometimes that's impossible. But by providing information in between board meetings, communicating with board members if necessary between board meetings, allows you to have a much more effective board meeting and overall relationship with your board members, with that little bit of extra sweat equity. So hopefully what we've covered today has been very helpful. I see it's 2 o'clock, but Sarah, are there any questions that I can hopefully quickly answer before we let everyone go?
All right, thank you so much, Scott, for your time today. This was an incredible presentation. So I've only received 2 questions privately to me. So you guys can enter in the chat. You can ask the question to everybody, send it over to me. While we read out these 2 questions, I'll give you time to ask any additional questions. So the first question is, will I be getting a copy of this presentation? Yes, you will. You will get a copy of the recording. And then, Scott, are you going to be sending me the presentation to send the slides as well?
Yes, I can do that.
Perfect. So everybody will get both the slide deck as well as the recording. So that is awesome. Thank you so much, Scott, for that. The second question that we have is, I am a community-based hospital. We have a community-based board. How do we work with a community-based board that has no healthcare experience and a lot of times doesn't even understand what we're going through? For example, we are going through a coding audit right now. The expense is quite high. They just simply don't understand why we have to do this process. So what do you say to that, Scott? How do they work with that community board?
So that's where, when I talk about sweat equity, let's assume that you're meeting with your board maybe on a quarterly basis, whatever the case may be. Even if you're meeting with the board on a monthly basis, when you're talking about, if you're dealing with board members who have absolutely no healthcare experience, it's impossible. I mean, I almost hate to say it, and maybe this is not what you want to hear, that you can communicate the details of such an audit and getting their understanding. You have to provide information to them on a regular basis. And so, and again, it's an art much more than a science, because it becomes a style issue that you have to put down in written format a summary of the audit and the issues that you're dealing with. And again, when you do that for the first time, it'll probably be potentially an utter failure. But it provides an opportunity that the board members can provide feedback, ask questions. And those questions that come back from the board members allow you to change the way you're communicating your message, so that it's not just a one-way, I am reporting to the board. It becomes a dialogue back and forth. But you have to have those opportunities to communicate on a more frequent basis with your board outside of the board meeting. And again, what I've done when it becomes a very sensitive or significant issue, sometimes it's a phone call, at least to the board chair, to let him know what's going on. And again, I don't know the size of your board. We like to keep our board size smaller, which means usually less than 10. If you have a board of 20 members, obviously that's much more difficult to do, but it just means that you got to roll up your sleeves that much more, because you have more individuals that you're communicating with. So hopefully that answers your question. If you have any follow-up questions, feel free to zap me an email, and I'm happy to talk with you about it.
Right, so we have a couple more. So one is from Britton White, who has a great recommendation. So the main question to ask internally for healthcare organizations is, if my network has to be shut down due to a ransomware attack, will I still be able to access patient information and continue to provide the same level of care? Will my EMR, EHR still be accessible if the network is shut down? What about ancillary systems that are critical to patient care? That is a great recommendation, Britton, and it also goes to show, so regardless of what organization type you are, what your background of your board is, they're going to understand not having access to information. So if you can relate it back to something that they're familiar with, that will be extremely helpful to them. And those are also really great questions, especially with the prevalence of ransomware attacks and other malicious actors, to ensure that cybersecurity is in there. And then we have one other question from Dr. Bo Deluck. Does the board have to communicate to the staff? If not, to who?
So typically the board communicates directly with the senior leadership, and 99 times out of 100, that means it's the CEO or the administrator. Now, that being said, you know, again, it's my opinion. My style issue is that the board has an open invitation to talk with staff. And so to me, what that means is that there's complete transparency, that if a board member wants to come into the organization and walk around and talk with staff, they're more than happy to. And I think that's helpful for board members to do that. Now, if they're doing that every day, I mean, again, that's a gross example that may be overkill, but you know, there's got to be a balance because you don't want your board getting involved in the details of the operations. So it's a balance, but if it helps them get an understanding of what's going on within the organization, I think it is a good open invitation to have with your board.
Right. Okay, so one more. So my good friend Mike Long has a statement. One thing the board needs to be aware of is the civil penalty is just one cost aspect of the breach. The case of John Doe versus Mount Sinai, which is the HIV fax case that Scott mentioned earlier, that's the monetary figure that was paid to the federal government. The civil lawsuit is still making its way through courts, which is the cost to defend, the cost to settle, and the possibility that the plaintiff may win the requested judgment of $2.5 million, which is what the plaintiff is seeking. All of those are the costs that the board needs to be aware of, not just that cost of the government settlement. That's an excellent point, Mike. Well, those are things.
I agree.
Yeah, I know, Scott, you and I have talked about this before about what the cost of compliance is. Everybody just wants to know, what am I going to pay the government? And this is going to be a landmark case once it is settled, because it's going to set a huge precedent for civil suit.
Oh, and I think with almost every breach that's settled with the OCR, there's always that civil component or lawsuit that's also ongoing. You know, just take a look at, you know, the Anthem Breach. You know, the fine imposed by the OCR, which was a record for them, was $16 million, but the civil lawsuit was, you know, significantly greater. And I think Mr. Severino said, you know, because he was asked, why was the fine only $16 million? And it's because that's the guidelines set at the federal level. They couldn't fine Anthem any more than the $16 million. So, yeah, good, very good pickup, very good point. Thank you.
Thank you guys so much for all these really great questions. If you guys have any other questions, you can feel free to shoot them over to me. I'll make sure that Scott gets them. Thank you again so much, Scott, for your time. Really, really insightful presentation. Thank you very much.
No, thank you, Sarah. Thank you, everyone. Hope you have a great rest of your day.
All right. Thanks, everybody. Bye-bye.